Hello everyone, you are all welcome to lecture number 1287 and today's topic is prostate cancer, its causes, symptoms and treatment. The word cancer is 6-letter word, but it is just like bullet. If anybody who is hearing the word cancer, he's half dead mentally, psychologically, emotionally. So first let me tell you, the word cancer is not today's word. 2000 years ago, Hippocrates, at that time those who were having the knowledge of science, nature, medicine, in Greek, they were known as Hippocrates. And Hippocrates gave the name carcinoma. And this carcinoma word is Greek term, became carcinoma. And in Greek language, carcinoma means crepe. So the tumor, which looks like crepe, and that's why they started calling it as a carcinoma. That is carcinoma, and finally it became carcinoma, and today we are calling it cancer. If anybody is getting cancer in any part of the body, there are 200 type of cancers. Someone is called blood cancer, breast cancer, lung cancer, cervical cancer, so many like that. So the word cancer, if it is diagnosed by oncologists, it clearly indicates that the number of cancer cells are drastically multiplied in your body. It is overnumbered. It can be detected. And then on the basis of test, you will be diagnosed that you are suffering from that particular type of cancer. So, why and how it happens? Till today, the first scientific research indicates that anybody who is diagnosed the cancer clearly indicates that his immune system is either failing or it has totally compromised or failed. This is the first indication of your health. And immune system, if I am saying immune system, T killer cells, means white blood cells, WBC, they are failing. They fail to neutralize and to clear the enemy cells, pathogens, bacteria, virus, cancer cells. And they are escaping and they are multiplying. So this is the basic fundamental of cancer. But today, the cancer treatment, cancer diagnosis, it has crossed the limit. As per 2023 report, if we calculate all together the expenses globally, creating infrastructure for diagnosis, for surgery, for chemotherapy, for radiotherapy, all together, it is coming to 1.9 trillion US dollars. This is the costliest. This is the costliest treatment. And the drug companies, pharmaceutical companies, they have big business. According to 2023 report, 150 billion US dollar worth of drug was distributed, and pharmaceutical companies, they got 70% profit. It's a big marketing game of pharmaceutical companies. Then come to diagnostic centers. Then come to treatment and surgery. So surgeons, They are getting 50 to 60 billion US dollar, even the surgeons. And in the treatment, their money is less than drug producers, those who are dealing with drug marketing. That's why this cancer disease treatment diagnosis is a big business and also big market. You will be surprised to know that there are many countries like Qatar, Kuwait, and including Nigeria, many countries, their GDP is less than, very much less than 1.9 trillion or 200 billion or 300 billion US dollar. Cancer is the costliest treatment in the world, where once we are identifying the human population, upper class, upper middle class, lower class. So up to upper middle class. In India, upper middle class means those who are having up to 50,000 to 100,000 Indian currency income. In Nigeria, if you are considering upper middle class or middle class, their income is just not more than 400 to 500,000. The professor's salary in Nigeria is 500 naira per month. If it is converted, it is roughly 400 US dollar. So even the upper middle class globally, they cannot afford the treatment. For example, in India, for cancer treatment, it goes from Indian rupees from 30 to 50 lakh. If I say 30 to 50 lakh means it is around 60,000 US dollar, 50 to 60,000 US dollar. And that is, impossible for 90% Indians to afford. If we are talking of the same treatment, in America even, it goes from 50,000 to 100,000 US dollar, even more than that. So if any cancer patient, if they are going to any hospital, first question they will ask, are you covered under health insurance or not? Once you will say that you don't have health insurance, they will not admit you. They will ask second question, how are you going to cover the expenses? Because it is too costly. One injection may cost 70,000-60,000 rupees. Indian currency, maybe around $700-800 or $1,000. So it is really terrible condition. So in that circumstances, the best thing is that if you cannot afford, I am talking of 90% population. I am not talking as an oncologist, the cancer specialist. I am talking as a professor of medicinal chemistry who understands the protein chemistry of virus, cancer cell and bacteria. So my experience, what I am sharing with 90% population, best thing is that if you can manage your lifestyle, your diet, your daily routine, and also the anti-inflammatory, antioxidant foods, then you can manage and you can drastically reduce the chances of getting cancer and the chances of death. You can manage for 20-30 years, even if you can, because basically, let me tell you, everybody is cancerous. Everybody is the carrier of cancer cells. Nobody is without cancer cells. The only difference is that when somebody is diagnosed with cancer, means he is suffering from oxidative stress or he is suffering from immunoproblem, his immune system is compromised. That's why the number of cancer cells are multiplied and they are not killed and destroyed by T cells, WBC, that is immune system killer cells. That's all. Otherwise, everybody is having cancer cells. So what we can do, the best thing is that everybody cannot afford. For example, if somebody is thinking in Nigeria, it will be 50, 60 or 100 million naira. They cannot dream and imagine of treatment of cancer without the support of government. And globally, governments, they are creating the infrastructure to treat, to go for surgery. There are a lot of latest developments are there. I will discuss that. I have gone through some latest research publications of Johns Hopkins Hospital, Harvard hospitals, and how they are targeting. Because nowadays that is called targeting medicine, precision medicine. Precise means when we are doing radiotherapy or chemotherapy, this is the most, we can say, advanced and best treatment of cancer. That is immunotherapy. So we are targeting the cancer cells to kill or to destroy them. So in that targeting therapy, along with cancer cells, lot of our normal cells are killed, and that is causing lot of harm to the patient. To avoid that, we are shifting and we are doing the research how to very specifically target only and only cancer cells. So the targeting of cancer cells is also by lifestyle. For example, I'm very thoroughly discussing this thing because it belongs to medicinal chemistry. It has deep chemistry. Cancer cell is a protein. We are organic chemists, medicinal chemists. We are dealing protein. And protein chemistry is very complex. It's not that only secondary or primary structure it is protein. No. Lot of hydrogen bonding, lot of hydrogen, oxygen, carbon, they are playing role in the form of different type of ligand and bonding, in the form of WBC T cells, in the form of stem cells. Lot of deep protein chemistry is involved. I am not going in deep because I am not delivering the postgraduate or PhD student lecture. Here I want to make it as much as possible very, very simple to make common man to understand, and how a common man, poor man of Gaza Hill or Kanduga or Bama, they can take care of their cancer and good management so that they can survive for longer time. So the first thing is that if you are diagnosed with prostate cancer, breast cancer, or any cancer, first thing is you should know the behavior of cancer cells, their food, their health, how they multiply very fast. So that knowledge we are here to share. So first thing is that cancer cells, they multiply very fast in acidic medium. Cancer cells, they fly very fast in acidic medium in your body. So what is the meaning of acidic medium here? Acidic medium means there are two types of food. One is alkaline food, other one is acidic food. Acidic food means where all the animal products which are made up of protein and their final, after hydrolysis by enzymes, product is amino acid. So once they get acid in the body, they are very comfortable and they will multiply very fast. So first you reduce the type of acidic food, means all type of meat, drastically reduce all type of trans fat. Trans fat means any oil or any fat which is solid at 25 to 30 degree centigrade. So first thing you have to do such type of things. So secondly, To go to alkaline food means to shift to fruit and vegetable. Because fruit and vegetables, they are very rich source of antioxidants and anti-inflammatory compounds. So once you are shifting towards 80% fruit and vegetables, means you are making your digestive system, your gut, alkaline. And once it is alkaline, the 80% chance of multiplication very fast is drastically reduced. It will not be very fast. So here there is time factor. In second part, I am going to deliver the other, we can say, my personal experience, and I am discussing in very detail, in a very simple way. So here, let me show you here what I have written. The same thing I have already told you. Hippocrates is created with naming as carcinoma, and this carcinoma word is Greek, and it became carcinoma. Today this carcinoma is practiced, different type of carcinoma. And then, because why they mentioned is that this tumor looks like crab, and let me show you in Greek term means carcinoma means crab. So let me show you the image. This is crab. In Greek language it is called carcinoma, and the carcinoma term is derived by Hippocrates some 2000 years ago from carcinoma, and that is called carcinoma. This is the carcinoma protein cell, which very much looks like, this is a tumor cell, looks like crab, and that's why the Hippocrates, they gave the name carcinoma, and that is called carcinoma, and today we call it commonly cancer cells or tumor, cancer, malignant cells. So with this I will stop here. In second part I am going to continue, and it may take even second or third part, but I will continue so that very clear picture all of you should get. Once again, thank you very much for watching the lecture.